There we go. All right. Hi, everybody. Welcome back. I hope you had a little chance there to do some networking and talk to old friends or new friends. I think we had a great beginning to the sessions this morning. I don't know about the rest of you, but I thought Bryony was just an amazing speaker, so powerful. So thank you, Diane, for bringing that to all of us, or bringing her to all of us and her story. And then a great overview of the World Pancreatic Cancer Day campaign from Jess and Craig. So I think it sounded from the chat that everybody's excited about it. It's really a beautiful campaign, and the committee has done a wonderful job putting it together. And so we're excited. It's just 2 months away, hard to believe. So we're heading into the last session. 3 days goes by fast. And I'm excited for this wrap-up discussion based on all of the regional Zoom conversations that you all took place in yesterday. I know my session had a vibrant, robust discussion, and it sounds like everybody else did as well. So as a reminder, Zone 1 was attended by members and sponsors in Europe, Asia Pacific, Middle East, and Africa, and Zone 2 was attended by members and sponsors in the Americas. So what we've asked the moderators from each of those sessions to come today, but from the diet and nutrition session, from the molecular profiling session, and from the clinical trials session, and to give a summary of the discussion that they had with their groups, and then put up the top priority that was voted as the top priority from each group. And again, you know, the idea was that we were talking about what are the biggest challenges that our community faces, and then what are solutions. Solutions that are easy to implement now, solutions or ideas that will be more of a stretch to achieve, and then those big, audacious ideas that are dreams. So we're going to hear from everyone what was voted as the top choice. And I think as you hear these, you know, it's not possible for the coalition to take on all of these efforts. Hopefully there will be some things that we'll be able to implement into the coalition's work. But more importantly, you know, these are great ideas for you to take back to your own organizations, to think about what you can do in your country, and to think about how you might be able to do some of these things if you partner with other organizations. So let's get started. We're going to start with the diet and nutrition topic. And we'll start with Anna Jewell, who represents Pancreatic Cancer UK, and she was part of Zone 1. So Anna, over to you.
Hi everyone, lovely to be here this evening as part of this conference and to be talking to you all about the really interesting discussion that we had about diet and nutrition yesterday. So I'm going to feed back on a few of the key issues that we talked about, and then talk to you about the big idea that we came up with. So really, in terms of diet and nutrition, some common issues that were identified across Europe, Israel, and Australia is that there's not enough awareness, information, and support available around nutritional symptoms to help people manage the impact of these. And these are, you know, big impacts such as loss of appetite, weight loss, nausea, bowel symptoms that can make it difficult to tolerate treatment, impact on survival, impact on people's quality of life, their daily activities, even their ability to want to leave the house. We also talked about cachexia being a big issue, leading to 10 to 20% of body weight being lost, increased mortality, and estimating that it can cause up to 30% of pancreatic cancer deaths. Lack of a specialist dietitian support and access to dietitians was limited, especially for those living with inoperable pancreatic cancer. And for those patients, either there might not be dietitians available at all in the country, or perhaps you can only access a dietitian easily if you're having surgery for pancreatic cancer. We also talked about there being a lack of awareness amongst other, maybe less specialist health professionals that are involved in treating people with pancreatic cancer about dietary and nutritional impact of pancreatic cancer, and the need for more support and the need for better awareness and use of pancreatic enzyme replacement therapy to help people manage their dietary symptoms. And for example, we highlighted that in the UK, only about 50% of patients get access to that really important treatment of enzyme replacement therapy. We also discussed that many patients and carers may not be aware of what a pancreas does, what dietary problems pancreatic cancer can cause, and that perhaps they can and should get help to manage their dietary symptoms, and not aware that there might be a dietitian that can support them and help provide really personalised advice to help them manage those symptoms and help tailor that advice to them. We also talked about the potential role of diet in helping people stay well with pancreatic cancer, and also perhaps to prevent the development of pancreatic cancer altogether. Perhaps there is more we can do to keep the pancreas healthy, and that was an area of interest as well. But a lot of the issues seem to come back to a lack of awareness of pancreas and stem from a lack of awareness of what it is, what it does, what problems with the pancreas if it's not working properly. So the three I talked through, we talked about the need to do more awareness raising and training for health professionals, particularly those health professionals that are less specialist in treating pancreatic cancer, on dietary symptoms and the impact these can have on patients and how these can be managed, for example, through using enzyme replacement therapy. We talked about perhaps making more online courses available for health professionals that could be produced worldwide and translated into different languages, and getting these endorsed by leading dietitians and through the World Pancreatic Cancer Coalition. And, you know, he gave examples of ones that we at Pancreatic Cancer UK have produced. And that there was also a big idea, a big reach idea, in an interest in looking at how dietary factors may increase the risk of pancreatic cancer, and how can we help people stay, you know, keep their pancreas healthy and reduce the risk of pancreatic cancer. So there was an idea put forward with strong support for an international research study on the impact of dietary factors on reducing the risk of pancreatic cancer and helping us prevent the development of this disease. But the idea that everyone voted was the strongest idea coming out of our discussions was centered around the fact that everything seems to start with a lack of awareness of the pancreas and its importance to people and helping them to stay healthy and be able to have good nutrition and digest their food. So the big idea was really around the need to raise awareness globally of what the pancreas is, what it does, why it's important, what can go wrong when we have pancreatic cancer, and the impact this can have on those diagnosed with the disease. We're all very aware of what other parts of the body can do and why patients might need support when cancer affects their other parts of the body, such as the lung or the brain. And we need to raise the need for specialist dietary support for people with pancreatic cancer, and to educate for patients to seek and ask for dietary support, as well as ensure that dietary provision is available. But we felt that all of that starts with raising awareness of what the pancreas is and what it does.
Excellent. Thank you, Anna. That was a great overview. And I should have said before, if anyone has any comments or questions, please put them in the chat or in the Q&A, and we will get to any questions that you have. All right. Well, Anna, you stay here, and we'll bring Stephanie up, who's representing Zone 2. Stephanie is with Craig's Cause in Canada, so we'll be interested to see how similar or dissimilar your conversations were. So, Stephanie, over to you.
Hi. Good morning, good afternoon, and good evening, everyone. I could really just say ditto and be done with it. Because a lot of what Anna covered, you know, we certainly see, our group certainly saw many of the same issues. We started off our discussion talking about just the challenges of even getting patients in to see a nutritionist. You know, even at some of the major cancer centers of excellence, nutrition doesn't always seem to be prioritized. Ironically, though, we all know that without that nutritional support and without those pancreatic enzymes, as many of our patients suffer with pancreatic enzyme insufficiency, we know that their quality of life is diminished, and also their life expectancy, the time they have here, is also decreased. And there's also a recent study that showed that patients with pancreatic enzyme insufficiency that are receiving nutritional support and pancreatic enzymes actually respond just as well as if they were on, just as if a patient was responding to chemotherapy. So what it's saying is basically nutritional support and pancreatic enzymes are just as important as best practices when you're looking at the treatment of patients. And we know that without that support and without that treatment, they don't have that quality of life that they deserve, and so, certainly one of the challenges is twofold, that patients and caregivers aren't getting that support, and our physicians, don't necessarily always refer those patients to a nutritionist, and prescribe the pancreatic enzymes. We talked about the pancreatic enzymes themselves carrying a huge cost in different provinces. So if you don't have the health care, patients are rationing the good pancreatic enzymes and alternating with the ones that don't work as well, just so that they have a little further support with the digestion of their food. We also talked about how if once again, the quality of life, if we can't support our patients, they can't stay in the chemotherapy treatment protocols that are assigned to them, because they're just not strong enough, they're not healthy enough to undergo the treatment that's being suggested for them. So if we can get them healthy with the support of nutritionists or dietitians and on pancreatic enzymes, research indicates that they certainly would be able to stay on chemotherapy for longer periods of time. We talked about, this is a big topic in the world of pancreatic cancer, that we provide the support for caregivers program. It was Canadian, but it's gone international. So we usually have participants from 6 or 7 countries. And whenever we offer one on nutrition or enzymes, it's one of the highest attended sessions. So we know that the need is there for more education, because the families and the patients aren't necessarily receiving that information and support from their healthcare team. We talked about the oncologist not necessarily knowing how to prescribe enzymes or understanding the research supporting the enzyme replacements. We also talked about the different types of pancreatic enzymes, because some of them do contain pork, which means that some individuals may not be able to take those. We talked about, there's a lot of great resources out there, but how do we get that? Where do you start as a patient? Where do you start as a caregiver? And where do you start as a healthcare professional? What resources are most reputable, most recent? So how do we disseminate that information and get that out to the public and also to the healthcare community? We talked about, think of what else. The referral process. I'm just going through my notes, excuse me. We talked also about, which Anna touched on, cachexia. There's a recent research paper that came out with patients who had PDAC cancer, so pancreatic ductal adenocarcinoma patients. So for 85% of the patients, so out of those patients, over 30% of them will have loss of life because of cachexia. And we also talked about the research not being not clear right now. So there's still a lot of debate of how cachexia starts, how do we treat it? So we're really just at the mice model stage of research in cachexia. So it means that right now, many of our patients that are suffering from this, will continue to suffer for it until we get some those research clinical trials out of the most model stage. We certainly talked about, once again, that Anna touched on, all the patient's quality of life, the weight loss, the struggle with food, even just the interest in food, not necessarily that they can't keep it in and absorb those nutrients, but they're not interested in the food. They don't feel well. We also talked, another big one was not only the cost of the enzymes, but also how do patients access those compassionate care programs within the pharmaceutical companies. That's not necessarily clear, and we do know that many of those pharmaceutical companies will offer up to 6 months free pancreatic enzymes. So it's important that the patients have these options and know where to find that, so that they can afford those enzymes and take those enzymes, which ties into also the insurance coverage. So many countries look different, and patients either have access through their insurance company or do not have access, whether it's for a nutritionist, dietitian, or for those enzymes treatments. So ideas within a reach. We didn't just stick with one. We did a lot of brainstorming, but the one that was voted, by the group was a one. So with an idea within reach is a one-pager. So the best global resources on nutrition to pass on to patients, caregivers, and practitioners. So taking all those resources and putting it into a digital format, one page, so that everybody in that journey, whether it's patients or the physicians, know where they can get the best resources for enzymes and for diet and nutrition. And we also talked about not reinventing the wheel. There are a lot of resources out there just within this group alone, within the World Pancreatic Cancer Coalition membership. So, how can we pull from each other, and certainly making sure that document is accessible in all the countries. Ideas that are stretch. We talked about creating another one page where we could highlight the pharmaceutical companies with the compassionate care programs and the enzymes that they're distributing. And that would include, it would be a worldwide document, but it would also include a phone number, a contact person, so that and an email, so that the patients or caregivers can reach out directly to those pharma companies and apply for those compassionate care programs. We talked about, that was just the list of the directory. We also talked about some dreams. We talked about, and it came from the idea of Elizabeth Jaffe from the scientific panel. She touched on the idea that it's hard to share data when institutions are doing certain research projects on their own, and also with the intellectual properties of the research. So she was indicating that you don't always get the data that you need to have more of a global approach to see what else is happening. So we also talked about that in our group, is wouldn't it be great to be able to bring all these collaborators and researchers together to share the data and to work together on certain research projects, so we're not replicating anything, and the research is furthered quicker with the shared data, and maybe we can get more support for cachexia, for instance. I think that was our big dream idea. Oh, and certainly increased awareness of cachexia and better treatment. We talked about, even though many of us are in this world of pancreatic cancer, we aren't always aware of everything. So how do we create more awareness about these diseases and different treatment options if they exist? And we also did talk, I forgot one, we talked about one that is in the here. We can certainly put on different forums, educating our membership even, and inviting the public to join as well on cachexia, nutrition, and pancreatic enzymes and pancreatic enzyme insufficiency. So that was something that we can do now. Also bringing patients together, having a forum that we're all a part of, and we can send it out to our membership and allow patients to, converse in this group and find support from one another. And I think that is it. I think I covered it.
Great, Stephanie, thanks. Very comprehensive. It's clear from both of your discussions that this is a really important topic for our patients, and there's definitely just a lack of information, resources, and really research in this area, as well as in other supportive care areas. And I think what we're going to see, some of the themes that you both brought out, I think we're going to see some of these same themes in the other topics. This idea of a lack of specialists, in this case, a lack of dietitians and nutritionists, or oncologists not referring the patients to those specialists. the need for to educate healthcare professionals, the need to educate patients and provide resources, this idea of a lack of awareness about your pancreas, but also about how diet and nutrition can play an important role in your care. And then I think, just there is a lack of research in cachexia around how we use enzymes. It's really a niche area that, organizations could focus in on. If people are looking for things that are not being done currently, that is definitely an area where an organization could have a big impact in an important topic. So thank you both. Any final words, Anna or Stephanie?
Oh, really, just to say, I think as you recognised there, Julie, it's just, I think, such a huge issue for patients, for those affected by, and definitely something we need to do more to raise awareness of and put pressure to really make sure that we're supporting patients and caregivers with managing dietary symptoms because of the impact they have, I think, on people's lives on a daily basis.
Yep, great.
Yeah, thank you.
Great, and maybe just to comment on your two top priorities here, which are both educational awareness in nature, just slightly different ways about going back about it. One is more of, I think, a larger campaign around what is the pancreas, and then relating that back to dietary support. And the one from Zone 2 is really just a simple one-pager about, it sounds like an informational page for patients and caregivers. So both are interesting topics. The Zone 2 one is something probably that would be fairly easy for us as a coalition to pull together, a one-page resource like that. The Zone 1 is something that we could take back, as a consideration for our future World Pancreatic Cancer Day campaign topic. So great work.
I will say one thing. I think that, it's all about raising, supporting our patients as they raise their voices and giving them the information and the knowledge to empower them to ask for this stuff. We're always going to be trying to educate the healthcare community, but ultimately, the patients that come to any of our organizations, if we can put the information in their hands, then we've empowered them to take on that role.
Yeah,
it's about knowledge.
It's a great point, Stephanie. And yes, it came up in the session that I was in, really this idea of patient empowerment. And that's what we're all here, is to provide these resources to empower patients to make informed decisions. All right. Well, thank you, Anna and Stephanie. Appreciate you. And so let's move on to the next topic, which was molecular profiling. And I'd like to invite Ali Stunt, who is representing Zone 1. Ali is with Pancreatic Cancer Action in the UK. So Ali is coming, I think. There she is.
Good evening, everyone. Good morning, good afternoon, wherever everyone is. Thank you so much for having me. And I have to say, we had some really, really interesting discussions. And I really think that it's a topic about molecular profiling that really needs to have much more focus on. And it's definitely something that we could have probably spent about 3 hours discussing, rather than the time that we had at the beginning. But just to run through some of the things that we raised, is that the main point was not many people know about molecular profiling. The public doesn't really understand the difference between a germline or a somatic mutation. Quite often, if patients will find out after their diagnosis that there might be a potential for genetic profiling, but more often than not, many people are not having those conversations with their clinicians, and it's not something that's offered. There is a real lack of information for patients, and there's really a lack of awareness in terms of the possibility of genetic testing, because this isn't raised with the patients, and also there's the public awareness of the fact that there are some mutations, such as the BRCA1 and BRCA2 mutations, that they don't know that they're actually associated with pancreatic cancer, albeit in relatively small numbers. And we need to make sure that people are aware and know what questions to ask. We also, the information needs to be disseminated, and also we need to make sure that healthcare professionals, a bit like the diet and nutrition we've just spoken about. So if you don't have clinicians, particularly maybe oncologists, who are in a specialist center setting, then they're very unlikely to have the latest information. And if they're a jobbing oncologist, then they're not really going to be bringing up the situation with molecular profiling. We've also got an issue with regard to, okay, well, if we have done the molecular profiling and then we find that there are some mutations that can be targeted, there are some countries that may not have those agents available to them, and that is a big issue. Is it fair that we test people and then they can't have any of the therapies that might target their mutation? Also, coming up was genetic counselling. It's very patchy. Certainly, we were talking about Greece and Israel and the UK and Australia, and genetic counselling is not routine, even when people are able to have the test. I have to say, Israel in their specialist centres seems to have a more advanced system in terms of profiling patients. So, the other thing is, going back to your wonderful study, Julie, the Know Your Tumor study, when you guys discovered that 25% of patients have an actionable mutation. With that percentage, would it be ethically right or wrong not to actually test patients on diagnosis? Because this could make a significant difference to people's chances of survival and surviving longer. We have various barriers. Who's going to pay for the testing? That differs depending on where you are. But not only that, because whilst you could have payers in different countries, there are some guidelines and regulations, certainly here in the UK, when you've got mutations affecting less than 10% of your patient cohort, then automatic genetic testing is not applicable. It's not in the guidelines. So that's a barrier. Whereas if it was in the guidelines here in the UK, it would be free, but it's different in other countries. And again, are we limiting people's access to clinical trials if they've not had a molecular profile of their tumor done? And we also felt we had to be very realistic with what this would bring to patients, and to make sure that we manage public perception and people are having honest conversations, because having a genetic mutation and also a targeted therapy doesn't necessarily mean that this is going to be something that's curative and will definitely prolong survival for patients. So we have to be really careful about the conversation. So we need education for healthcare professionals, and there was a light at the end of the tunnel from David Chang, sort of saying, look, there's a new generation of oncologists coming through who are much more well versed in all of this. So it's the crusty old ones that we probably need to educate. And so we realize that the public needs to have better awareness, and we need to produce some assets and that kind of thing. And as a coalition, that would be a really good quick win. But our feeling from our group was that we really need to have an international audit in terms of what is offered in which country, how is it paid for, what are the backup services like genetic counselling, and what are the therapeutic agents that are available? Are they available on a compassionate basis if people have had the testing, etc., etc., etc.? we haven't had time to formulate the questions, but really feel that if we do a global audit involving all of our member organizations to actually determine what that landscape is, that's going to not only answer some questions, but it's also going to provide further questions that we might need to explore, whether that's on a global level or whether that's at individual country level. We did have a pipe dream, making sure that not only is the molecular profiling free for everybody, but everybody gets it, because there's a huge impact for not only the patient who may well be a carrier, but also their families going forward, and the surveillance that's going to be needed for them as well. I think that's it. I've rattled through. Happy to answer any questions later on, but I do need to let Frederica have a little bit of a say.
That was a terrific, great overview. And I think here's some of the similar things from Zone 2. So Federica led Zone 2. Federica's from Italy. I'll let you take it away.
Thank you, Julie, for the introduction. And thank you, Ali. Yes, I mean, I'm going to repeat a lot of things that you just said. The problems are common in Zone 2 as well. So we started our conversation like introducing what is genetic testing and molecular profiling, and why it's important for patients to know that. It is important because it's going to guide the patient's treatment, and it's going to be important for potential family high-risk people. So it's really, really a key component of pancreatic cancer. Do patients and family knows about genetic testing? Not much. So we absolutely convene that we have to educate, first of all, the patients and the family in order to know what is exactly a genetic testing and what is the DNA. You know, it's a very difficult topic to explain to people. So we need you know, the right way to explain these things. And the second part is, of course, related to general practitioner and oncologists. That also has to be educated, because as you might know, patient can ask about genetic testing, but then the oncologist would say, no, I don't think it's important. So there's these two big components, educating the patients. And to come back to Julie's point, what came out from our conversation is that empowering the patients is the first thing to do. They have to have the knowledge, first of all, themselves about what's going on, and then therefore can, you know, influence somehow the doctors and talk with the doctors about these things. Another aspect very important that came out is, as you said, the genetic counselor. So we think that in these big centers of reference for pancreatic cancer, that the genetic counselor is going to be there, but it's not always true. And we know that by default, actually, these patients should go and talk with the geneticists about their history of pancreatic cancer. And that's another component. So we should involve this expert on genetic much more than before. And also they are the ones that are able to explain to patients in a easy way what we are talking about. We know that, as you said before, we don't have to reinvent the wheels. For example, BRCA mutation, now we know is correlated with pancreatic cancer, but not many people knows. There's a lot of advance in treatment of colon cancer or lung cancer or breast cancer, because we know the genetic. So the things are already happening for other diseases. So we should make sure, we have to make sure that it's happening also for the pancreatic cancer. So we came out basically with three ideas. The first one that we put at the first position is, again, empowering the patients and educate the patients. How we can do that? Well, the easiest way is through telling stories of families, for example, with BRCA mutation or other kinds of mutation. I know Let's Win does an amazing job on that. So we should be able to share stories so that people can understand. The second part is, educate the general practitioners and the oncologist. And again, we can dream big, and it would be great if cancer organizations like Oncologists Association will help us to put together guidelines or this famous one page of reference that everyone can use. But is a bigger step. So to go back to the nutrition part as well, empowering the patients and educating is again the key for this kind of message to the patients and to the doctor. So we put at the first choice the sharing the story of patients and family, and therefore we can educate better the population. That's pretty much what our team came out with. Of course, there's a question about cost, as always. So we have in Italy a national health system, in US a private. So who is gonna pay for what? In Italy we are still like fighting to get the BRCA mutation test paid by the national government, and we are talking about one mutation out of 18 pancreatic cancer. So it is a long way to go, but let's start educating ourselves, because we have to be advocate of ourselves when we are patients, right? You know better than me, Ali. So yeah, that's it. If you have any question, happy to answer.
Thank you, Federica. That was a terrific overview as well, and definitely lots of similarities between the two discussions. And really a lot of the same themes, even from the first discussion around diet and nutrition, these ideas of there's a need for HCP, healthcare professional education, there's a need for patient education, there's a need for patient empowerment, there is not access to tests, the costs, a lot of the similar topics. But this is another, I think, really clearly very important area where we've, excitingly, we've learned so much, really, even just in the last few years in this area. And we can just imagine, over the next decade, what we're going to continue to uncover and learn to really guide patients to the best treatment for them. So an important area where, organizations should be paying attention to and consider funding in this area too. So the two, let's just look at your two, in this case, your two priorities are different. One being to conduct an audit, which I think is a really interesting idea and may lead to, future research topics and future areas where there's a need for materials and resources for patients and families. That's probably a separate project from what doesn't really fall into the scope of the coalition today, but something we could certainly consider. And then the other one is more of, again, an awareness campaign. So this is something that could be a topic in a future World Pancreatic Cancer Day campaign. So I guess the good news is for our World Pancreatic Cancer Day committee, we don't have a lack of campaign ideas that we need to educate the public about, and we'll, I think, always have a good list to choose from. So great job. Any final comments that either of you want to make?
I can just say that it's impressive to see how around the world the problem of the patients are always the same. Yeah. It doesn't matter if you live in a poor country or in a rich country. Someone told me before, maybe the solution can be different, but at the end of the day, the problems are everywhere the same. So that's why this this meeting is really, really important, and we learn a lot from each other, and we work together towards the same goal. So it's amazing to be here. Thank you.
I think also just very quickly, Julie, because I know we need to press on, but just to sort of say that, one of the things that is coming out is that there are areas, no matter whether it's diet and nutrition or whether it's molecular profiling, that there is best practice happening. Even the best practice could be improved, but I think there's lots of learnings that we can take from other countries or regions who are maybe doing things a little bit better for patients. And I think that's the sort of thing we need to, as a coalition, translate down through our membership.
Yep, I think that's an excellent point. As an example, in the United States, this actually is now in the guidelines for pancreatic cancer, but I know that's not the case across the world. But it also doesn't mean that all oncologists in the US are doing it. So we still have, some of the same barriers and challenges. So thank you both very much. Excellent job on such an important topic. All right, so let's move to the last topic, which was clinical trials. And I'd like to start by inviting Dr. Lorraine Chantrill, who is representing Zone 1. And Lorraine is an advisor to Pankind in Australia.
Hello, everybody. Good morning from Australia. It's really nice to be here. And I'm a medical oncologist, and I've had the great privilege of treating people with pancreas cancer for some time. And I was very honored to be part of this group. And we had a fantastic discussion about clinical trials with people across Europe, the Middle East, and the Asia Pacific. So it was a very robust discussion. But I think all of us agreed that the principal problem for clinical trials for people with pancreas cancer is access. Patients don't know what trials are available and how to access them. And so our group actually voted almost unanimously for a dream idea. And I'd like to indulge you with this dream idea and just paint a picture of it for you to see whether the coalition might take this on. So our dream idea was that we use the networking that's been established by the World Pancreatic Cancer Coalition to establish a clinical trials portal. Now, this clinical trials portal would be global, and it would be highly influenced by patients, and it would establish cultural trust with disadvantaged groups, because one of the issues is that patients who are disadvantaged by language, by culture, or by geography aren't able to access clinical trials. The clinical trials within the portal could be very comprehensive. So they could be prevention clinical trials, or trials about early detection, or trials about screening, or trials about treatment, any kind of treatment, surgery, radiotherapy, chemotherapy, immune therapy, targeted treatments, molecular profiling, etc. And we're not pretending that we'll create those trials, but all we will do is provide an information hub for people to access so that they can work out which trial is right for them. This would actually need to incorporate the use of the technology that obviously you guys are super at, because you've created this technology where you can all interact. And we would hope that we can use some of the technology that we've learned from the COVID pandemic to be able to link people with trials who may have difficulty going to a central trial centre. So in Australia, we're starting to do this. It's a difficult thing to do, and there are a lot of regulatory barriers, but we are jumping those barriers slowly but surely, so that someone who lives in the middle of Australia can talk to a specialist oncologist in a metropolitan centre about a clinical trial. Now, if they're really interested in that clinical trial, they may be prepared to travel to the central place to have the study, or it might be this kind of study that they could even do from home. You know, it may not be a study that involves a potentially toxic treatment that they have to go to a special center for. It might be something that's much easier to do from home. So we would like to incorporate all of that technology and that very important cultural competence and trust. We think that maybe we could even quarantine some spots for people who are otherwise disadvantaged. So maybe there are big centers that have lots of trials, but maybe they don't have patients, but maybe a small country doesn't have the trials, and we could reserve a few spots for some small countries, or we could reserve spots for certain groups that we feel are not properly represented in clinical trials. The ideal thing would be that a patient, a carer, or an oncologist would be able to go onto this portal and say, my patient has this type of pancreas cancer with this kind of molecular profile. They live in this postcode or zip code, and they're prepared to travel X number of kilometers for treatment. What trial is available for me? So that's our dream idea. And I think from talking to all of you and from seeing what you've been able to achieve with this year's meeting, that the coalition could definitely do this one. So thank you very much.
Terrific. Thank you. Definitely an audacious goal, but a good one. And maybe small steps to that. There are probably some clinical trial database systems already in place in certain countries where the information, at least in a particular country, already exists. So that may be a stepping stone to something bigger like that. Great. Well, thank you. That was a great summary. And now representing Zone 2, it sounds like we're doing like a match or something. Cassidy Moravec from PanCan.
Thank you, Julie. And I love that big, audacious goal. Would love to see that happen someday, very soon. So just to recap our zones discussion, first, thank you to the group for the robust discussion and brainstorming of all of the challenges, and then some of the ideas that we could work together to overcome those challenges together. So just to start on some of the challenges, which I think we've heard across the groups today, include education first and foremost, not only for healthcare providers about clinical trials and the importance of clinical trials and having those conversations with their patients, but also for patients themselves and the general public. Just really education overall around the importance of clinical trials and kind of debunking some of the myths around clinical trials as well, really building that trust even before a patient is diagnosed with pancreatic cancer and is being overwhelmed with the amount of information, including clinical trials available. So we talked a little bit about, is there a way to educate healthcare professionals at the medical school level? So bringing it into their curriculum about the importance of clinical trials and how they really should be considered really as a first treatment option, especially for diseases like pancreatic cancer. The other thing that came up was access, which the previous group talked about. Absolutely, it came up over and over again. It's not only access for patients to be able to get to a clinical trial site, but even just to get to a provider that will have that conversation with them about clinical trials. So we really took a step back and said, really to improve clinical trial enrollment, it's helpful for patients to get to a clinician who understands clinical trials, has that conversation about clinical trials, because we've heard from providers that sometimes those clinical trials conversations don't happen just because of the lack of time that they have to spend with patients, and it's another conversation, so it doesn't often get brought up in the beginning or even throughout the journey. And then on the flip of that is bringing clinical trials to the community, to global populations that may not have access to academic healthcare centers. Another theme that came up was actually around permission and how patients often look to their providers to get permission to enroll in a clinical trial that isn't at the site that they're being treated at, or even to obtain a second opinion, and how there is that trust built with the patient's oncologist, and kind of being able to have that conversation, get that permission from the healthcare provider to be able to get a second opinion or go outside of the institution for a clinical trial. We also talked about eligibility and obviously how clinical trials can be restrictive, especially for some of the underserved populations, just the way that the clinical trial eligibility criteria is structured. And then finally, we had a robust conversation around the mistrust and the disinformation out there about clinical trials and just treatments in general, and how, in addition to all of the information patients are getting from clinicians, they're also getting a ton of information from well-meaning family members and friends about taking X, Y, or Z, and how that type of information can sometimes cloud and wouldn't be coming necessarily from a source of a trusted source. So really, how can we overcome that? So those are all of the kind of the main problems that we've pointed out. And then as far as solutions, we threw a lot of them up there, but I think one of the, I'll just start dream and work down to what we selected. So one of our dream solutions was really around the globalization of clinical trials, and really how could we work together as a coalition, as coalition members with our industry partners, to be able to take trials to patients across the globe, regardless of where they are, and the ability for patients to be able to find those trials. So that was kind of one of the big ideas. Another idea was really around policy and influencing healthcare systems across the globe as to how to incentivize clinicians to be able to have the time, get reimbursed in countries where billing is an issue potentially, for those clinical research, clinical trial conversations to even happen at the beginning. One of our kind of stretch solutions was actually to build on what we currently know about the World Pancreatic Cancer Coalition member organizations, about the services they provide in general, but also specifically around clinical trial information. So do they have a clinical trial finder? Do they have education navigators that can help patients find clinical trials and understand clinical trials? Or are they sharing stories about clinical trials and about patients who have participated in clinical trials across different communities, across different languages, across different countries, and even in the underserved population where some of the distress happens. And then finally, the solution that we put forward and a lot of us voted for, the majority, was really about a quick win solution to really change or flex the messaging for World Pancreatic Cancer Day. So again, another campaign idea. And this was really about adding "and your options" to the "it's about time to learn about your symptoms and your options," and really being able to talk about the importance of getting a second opinion, talk about the importance of clinical trials, and really also capitalize and work with providers to provide these messages to kind of help with that permission piece that some patients are looking for from their providers. And then we didn't want to stop there, so we wanted to also add mini campaigns throughout the year to really focus on all of the conversations that are happening in the cancer community about clinical trial awareness and education. And so there's National Pancreatic Cancer Clinical Trials Awareness Month in January in the US that PanCan championed a few years back, it seems like just yesterday, and really building on that as a coalition and doing a mini campaign to bring some of what we maybe had used for WPCC and bring it throughout the year. And then also May, there's a clinical trial awareness day, a clinical research week, and then also just a cancer research. So just building on that and really being able to continue to talk about it throughout the year.
Excellent. Another great summary of another really important topic. All three of these topics are so critical for patient care. So really both of your conversations sound like they focused a lot around sort of access and education, right? One, we have to educate patients. We need to debunk all the myths. We need to make sure patients even understand what clinical trials are and why they should be asking for them. And then we need to ensure on the professional side that healthcare professionals are offering clinical trials, that there's a site, that's not 500 miles away from where a patient lives that they can get to participate in a clinical trial. And then, costs, of course, potentially also come into play. You both sort of said it differently, but this concept of we really want the trial to find the patient, instead of right now the patient has to find the trial. That's at least how I sort of summarized how you guys were thinking about, wouldn't it be great if there was something that identifies the patient for the trial, and it's offered to them, versus the patient right now really in a mad dash for information, trying to find, what's the best treatment option for them, where is there a clinical trial, and then when their first treatment is no longer working, what do I do now and where do I go? So lots of similar themes. So great job. And then your two priorities are definitely different, but again, both important. One really focused on this idea of, can we collect all of the clinical trial information, the current open and enrolling clinical trials, and help get patients to them. And then the other around more of a campaign, a marketing, education about clinical trials. So both, again, important topics, and lots of room here for organizations to take some of these ideas and run with them for the patients in their countries. Any other thoughts or comments from either one of you?
No, thank you, Julie. You've summarized it really well. Thank you.
Thank you so much, Dr. Chantrell. Cassidy, anything else?
Yep, I think that was perfectly summed up, and I think you hit the nail on the head when you summarize it as the trials finding the patient. I think that really is the ultimate goal, so that patients aren't having to do all of the legwork to find the trials, and really there are trials available for all patients and anywhere that they are.
Yep, great. Yes, and I believe as we continue to work together, we will someday get to that point where the right option is there for the right patient at the right moment. We just need to all keep pressing forward. So thank you both. Great discussion. So I'm going to try to summarize what we've just discussed and sort of next steps. I mean, obviously, again, 3 extremely important topics: diet and nutrition, testing, molecular profiling, biomarker testing, genetic testing. They have lots of names and lots of confusing terminology, but all really extremely important. And then clinical trials. It seems to me the themes that came up across the 3 topics are really about patient empowerment. We all believe very strongly that patients need to have information about these topics. They need to be informed. They need to know the questions to go in to ask their doctor so that they can make informed decisions about their care. So patient education is really important. Having clear resources that summarize some of these very complicated topics is an important resource that we all need to be creating and working on for our patient communities. On the opposite end is the healthcare professionals who also need to be educated on a lot of these topics. You know, we have a small cohort of pancreatic cancer, what I would call pancreatic cancer specialists, who see a very high volume of pancreatic cancer patients. But when you go beyond that and you go out more into the community settings, you know, I've heard oncologists say that, you know, maybe they see 5 pancreatic cancer patients in 5 years. And so there's no way those doctors, you know, have all of the relevant new information that, especially right now with pancreatic cancer, is coming out on a fairly regular basis. It's not the old pancreatic cancer where advances maybe happened every decade. We are now making advances every year. And so we need to be educating healthcare professionals, in particular oncologists treating patients, to be up to date on these things. And then the last sort of theme is this idea of access, whether that's access to a specialist, access to a treatment, things related to insurance and costs. So I feel like those are sort of the 4 themes that it really resonated across all 3 topics. And then we really sort of had 4 priority solutions. One being, we had 3 different campaign or marketing ideas that could potentially be used for the World Pancreatic Cancer Day campaign. One around knowing your pancreas and how that relates to dietary needs. One around this idea of testing, and one around clinical trials. So those are all really 3 critically important marketing campaigns, or an opportunity to educate patients and the public, that we could certainly consider and sort of put on a list as we think about our World Pancreatic Cancer Day campaign each year. Those would all be worthwhile topics. Then this idea of a one-page resource that came up, and it's specifically on the diet and nutrition, but it also could probably apply to all three topics, and may be an easy thing working with a cohort of members from different countries to put something together that, you know, works across cultures and countries. And then the two maybe that are a little more outside of the coalition's box, but things that we could think about for the future, one being a molecular profiling audit. So that's one idea. And then the other, the big one, the really expensive one, is a portal that would house all of the open and enrolling clinical trials throughout the world for pancreatic cancer. So some really great ideas. I think there's a lot of great ideas here for the World Pancreatic Cancer Coalition Steering Committee to take back and to think about what next steps might be, as well as the World Pancreatic Cancer Day campaign with regards to our annual marketing campaign or awareness campaign. And I hope that these topics also have inspired all of you. There's so many opportunities here for individual organizations to take a piece of these topics and really expand on them, and then network with partners to create sort of the whole picture. I know some of it feels so overwhelming because there's so much that needs to be done. But there's, I think, a lot of opportunities for step progress. You know, you create the one pager, then you know, do something, you know, more elaborate on your website. Then you're doing a bigger marketing campaign. You know, so take it step by step. Everything doesn't have to be done all at once. And I think, you know, a really great opportunity, especially within countries, for organizations to potentially each take a part and then partner together with the other organizations in their country to you know, make the splash even bigger. So really great discussions, clearly a lot of interest in these topics. And just a lot of room for us to continue to empower patients. And what I think is so exciting today is that we actually have information today that if patients are empowered with this information and are informed about the decisions that they make, their outcomes may actually be better. And I don't think that we could say that, you know, 5, 10 years ago. We really are, the field is making progress. It's not as fast as any of us want it to be, but it is our job to ensure we get it to the patients as fast as possible, so that they can take advantage of the research and make informed decisions about their care. So thank you, everyone. Bravo. Terrific discussions and sessions. I don't see any questions in the chat or in the Q&A. So thank you again, everybody, and to all of our moderators. And